I am BARNARD. I'm a physical therapist and clinic director here at Balanced Physical Therapy in PRUNEDALE. This is Elsa. She is a third-year physical therapy student at Cal State Long Beach, and she will be joining me today on a video series we like to call Gym Do's and Don'ts. Now, we've all been to the gym and we've seen those cringy movements where people are throwing their limbs around or they're pushing their head forward, and we know it's wrong, but we don't quite know what they're doing wrong. So someone like me, it's my job to identify those movement compensations and correct somebody so that they can move in the correct way and really reach their goals the fastest way possible. So join us as we come through a few exercises and demonstrate the right way to do them. Now, the first exercise we're going to be going over is the squat. It's one of the best exercises you can do, but a lot of times it's completed incorrectly. So Elsa here is going to be demonstrating some common movement compensations that we see during the squat. If you take a look at her knees right here, first off, they are going in front of her toes. We don't want her to do that. Also, you'll see her knees are dipping together into that kind of knee knocking pattern. In medicine, we call that knee valgus. Also, she's got a rounded spine. We call that increased thoracic kyphosis. She's hunched forward like that. We don't like that. So let's go ahead and show them the correct way to do a squat, Elsa. If you notice, her knees are staying behind her toes right there. Her patella, her kneecaps, are tracking along her second and third toes right there. She's got a nice neutral spine. She's not sticking her buns out or puffing her chest out too much. It's nice and in line. And her head is also in line with the rest of her spine, because don't forget, you have some spine up here as well. Now, this exercise is called the deadlift. It's good for your posterior chain muscles, meaning your hamstrings, your glutes, and your low back. So Elsa is going to show me how some people like to do their deadlifts. Now you'll notice that doesn't look very natural, does it? So her knees are dipping together into that knee valgus pattern, which we do not want and is usually indicative of weak lateral hips. She's also rounding her back like that. She's putting a lot of strain on her mid and low back and not targeting the areas that she's in the gym trying to hit, her glutes and her hamstrings. So let's go ahead and show them a proper way to do a deadlift, Elsa. So now, she's keeping her shoulder blades active. She's keeping her chest nice and proud with her shoulder blades back. The weight is staying close to her body. It's not too far out in front of her. Her patella, her kneecaps, are tracking over her second and third toes, which is great. And she's keeping a nice neutral spine. She's not lifting with her back, as I'm sure all of you have heard not to do. She's pushing through the heels and she's extending the hips to the top, getting that full flexion of the glutes, which she's trying to hit. Another exercise that makes me cringe when I see it in the gym is the bent over row. Elsa's got a barbell here and she's going to demonstrate how some people like to do theirs. So this is an exercise for your back mostly and a little bit for your biceps right there. So she is not going through her full range of motion of her shoulder, which we do not want to do. She's using a lot of biceps. She's not using hardly any of her low back right there. And to make it worse, she's bending her back over like that. She's not keeping a neutral spine. So let's show them the right way to do it. So ideally, you would get your back as close to parallel to the ground as you can, so you're targeting the muscles more in the mid-back and less on the upper back right there. She's doing a great job of initiating the movement with her shoulders right here and then going into the arms and the hands. She's not doing it the other way around. At first, she was rounding her shoulders. Now she's keeping a nice proud chest. And to cap it off, she's taking the full range of motion of her arms like that. Great job. Yet another one is the standing hip extension. I've noticed these come out a little bit more frequently in the gyms. Usually people have a strap around their ankle and they're doing it to build their glutes up. So Elsa can show us how some people like to do it in the gym. So if you look, she's extending her back like that. She's using a lot of her low back muscles to get that motion down, when really she should just be focusing on her glute like that. So now let's show them another way people like to do it. Here, she's not getting full extension in the hip joint right there. She's compensating by lowering her upper body forward with it. So she's really just counterbalancing her leg as opposed to using the muscles in her posterior hip to push backwards like that. So let's show them the right way to do it, Elsa. She's got a nice neutral spine. She's got her abdominals tight right there. She's not extending the back. She's not bending the knee, and she's having the eccentric portion when you come down nice and slow and controlled. Great job. You can also do internal rotation and external rotation to strengthen your rotator cuff in your shoulder. Rotator cuff is one of the most important group of muscles in your shoulder. Their main job is to hold the head of the humerus up inside the glenohumeral joint. Now you'll see people doing what's called an internal rotation really frequently in the gym. So let's see how some people like to do it at the gym. Okay. And she's trying to internally rotate her arm right there. And that's what we do not want to do. Don't do this, people. Now what she wants to do is maintain her spine neutral. You don't want to rotate anything else. Bring that elbow in right next to your body and get it just from your elbow out. You want the movement like that. I like to tell people, think about your humerus, your upper arm bone, as a barbershop pole, and those have red and white stripes around them, and they just rotate in place. They don't tip over to one side. So think about that arm like that next time you're doing an internal rotation. The other one will be an external rotation. So let's see how some people like to do it at the gym. No, don't do it like that. Instead, maintain your spine neutral without rotating. Bring that elbow right next to your body. Forearm is parallel to the ground, and you're pushing your wrist out there. She's doing a good job not extending her wrist, so we do not want to do that. We're not here to strengthen our forearm muscles here. We want to feel it up in the back of the shoulder right there. She's not rotating, she's getting the movement only from the elbow out, and she's got a smile. If you enjoyed the first of this video series, you can follow us online at Balance PT Move on Instagram or find us at balancept.com. Thanks, and we'll see you soon.